All right, well, let's go ahead and get started then. Thank you for joining our webinar today. This is hosted by the Gateway to Global Aging Data. My name is Tristan Phillips, and I'm at the University of Southern California, where the Gateway to Global Aging Data is hosted. And this webinar is going to be somewhere between, if you've been to one of our webinars before, it's somewhere between an introduction and an advanced webinar. But it's really meant as an introduction to the MHAS, the Mexican Health and Aging Study, in the Harmonized MHAS, which is a data product that ourselves at the Gateway and the MHAS team put together. That's a user-friendly resource for researchers. So I'm going to spend a little bit of time introducing just the MHAS study first, and then we're going to go through some sample analysis, particularly using MHAS and the HRS, the US sister study of the MHAS. If you have any questions throughout this webinar, feel free to ask them. There's a question and answer panel where you can ask those, and I'll keep an eye on those to be able to answer those. There'll also be a recording made of today's webinar, so if you'd like to go back and watch this later, we will put this up on our website, as well as the Stata code used from today's webinar will be available after the webinar, also on our website. So again, we meant this to be interactive. So if you have any questions, feel free to ask throughout the webinar. And also I'll stay on afterwards to answer any additional questions. And if you prefer to have a chat or a conversation, I can unmute individuals and allow you to talk. So you can just ask for that also. All right, let's begin then. We'll begin with just an introduction to the Mexican Health and Aging Study. So it's a national longitudinal household survey, and it's meant to study the health, economic position, and quality of life of those aged 50 and older living in Mexico. There are two phases of MHAS. So the first phase was conducted in 2001. They had a follow-up survey in 2003. And then the second phase followed that original sample and added refreshment samples, starting re-interviewing in 2012. And then they have 3-year follow-up since then. The study was designed to prospectively evaluate the impact of disease on health function and mortality of adults living in private dwellings in both urban and rural areas of Mexico. The study protocols and survey instrument are highly comparable to the United States Health and Retirement Study, or the HRS. The MHAS sample includes all 32 states of Mexico, both in urban and rural areas. And in addition, households in 6 states are oversampled or overrepresented because they account for about those 6 states account for about 40% of all the migrants to the US. At the time of that sampling was done. And one of the kind of like powerful uses of the MHAS is often to compare, to use it in conjunction with the HRS to look at, because the HRS also has an oversample of Hispanic individuals. So you can look at individuals who have family, both the family back in Mexico and in the US, or from states where some people would have gone to the US and some didn't, for instance. So in addition to like a regular core interview, MHAS also collected several other types of interviews or data. So those include next of kin interviews, and those are about the deceased study subjects. Anthropomorphic assessments among a subsample of respondents were done at most waves. Blood samples were taken at waves 3 and 4. A saliva sample was taken at wave 5. Hair samples were taken at wave 5 among a subsample. And then between waves 4 and 5, MHAS also did what's called an HCAP study, or a Harmonized Cognitive Assessment Protocol study, which they call MEXCOG, which includes a lot of really in-depth questions and protocols around cognition. If you'd like more information about MHAS as a study, they have a wonderful cohort paper in the International Journal of Epidemiology. I have a link there. And if you're wondering how to get to it, we'll briefly just go to our website, All right, so this is the gateway to global aging data, just g2aging.org. And on our site, if you click on surveys at a glance, you can see some broad overview here about MHAS. So for instance, that it's 50 and over, that it's one person, that it collects blood. You can also have links to all of the survey instruments and survey questionnaires themselves, both for core interview, end of life, life history, health assessment, self-completion, or age gap. And then also on study overview, we have a study overview page for MHAS. So we here have a link to the cohort profile. And then if you're looking for any more kind of broad information about the study and how it's collected, we have information on the sampling frame, data collection, sample, linkages, data access, and harmonized data sets. Here also is a timeline. This is that the MHAS team has generated of the MHAS study. So you can see that it was begun in 2001 and then re-interviewed in 2013. They started with 15,000 people interviewed. And then they had this kind of a long, almost 10-year gap, which is different than the HRS or some of the other HRS sister studies. But they came back in 2012, re-interviewing the people from the earlier sample and also adding a new sample of people who were younger, so born between 1952 and 1962. And then in their latest wave, wave 5, done in 2018, they also started another, they also resampled, again, focusing on people born 1963 to 1968. And you can also see some information here about the other measures that were collected. If you're not familiar with the whole kind of set of international HRS sister studies or MHAS sister studies, MHAS has sister studies in over 45 countries around the world, including the United States, England, most of Europe, China, South Korea, Japan, India, and through the WHO, also some parts of Africa. There's also a study called ELSI in Brazil. All of these sister studies, like MHAS, are population representative of older adults. They're longitudinal. They're multidisciplinary, so they don't just focus, it's not just like a health survey or an economic survey or a labor force survey. They really try to get at the multifaceted aspects of a person's entire life that we know have an impact on their choices around retirement and their context of their aging. They have coordinated survey instruments, as I mentioned. They have enhanced economic data, integrated biomarkers, and they are publicly available for anyone doing research. Partly to give researchers more access to all of these study data in a form which is a little easier to start to do research cross-study with. We at the Gateway to Global Aging Data have developed harmonized data sets. And so they're created to provide research-ready variables which are comparable between sister studies. So variables are defined as similarly as possible across all waves in studies. Each data set combines all waves from each study and each individual as one record. And that means it's a fat file, so it's quite long. All variables use intuitive variable naming. So for instance, a variable named R1 BMI is the respondents to R BMI as measured at wave 1. We also use study-specific variable names to indicate significant inter-study differences. For example, in the Harmonized Charles, and that's the sister study in China, we have a variable called R1 labor force underscore C. We've included that underscore C to mean that it's Charles specific. And that's because Charles asked about the labor force categories used in Charles were different than in the other sister studies. And that's because they're particular to the labor context of China. So sometimes there are study differences which occur, but it's really important to still include them. We include spouse versions of most variables. So for instance, a variable like S2 work is whether the respondent's spouse is currently working in wave 2. This is helpful if you're interested in the couple or family context. and it saves you the work of kind of doing since it's individual level, of doing that kind of spouse matching yourself. And then the variables have also been built to account for any survey skip pattern. So the harmonized MHAS, currently we have version B available. That was released last month. And that incorporates data from MHAS waves 1 through 4. We're in the process now of adding wave 5, but that data was just made available maybe 2 months ago. So we're in the process working with the MHAS team of adding that data. And one of the things you can see, the advantages of using the harmonized MHAS is that there are a lot of different files at a lot of different levels that are available at each wave. And these are all kind of combined into one data set. So it just cuts down a lot of the kind of the beginning and the entry and the startup work to being able to use the data set. The harmonized MHAS, though, does not contain all the variables at each of these waves. Instead, it really focuses on those variables which are most often used by researchers and which are comparable between different waves of MHAS and between MHAS and its sister studies. So it doesn't have everything, but it has the kind of the most frequently used variables. So particularly the harmonized MHAS has the following sections, the current version. So we have a demographics section, health, healthcare utilization and insurance, cognition, financial and housing wealth, income, family structure, employment history, retirement, pension, stress, end-of-life planning, and psychosocial. And actually the stress section, the end-of-life planning section, and the psychosocial section are all new to version B. So those were very recently added. In the version C, which we'll be releasing, my assumption is sometime early next year, we'll also include wave 5 will be available, and we have some additional sections coming, which include a biomarker section to bring in some of those anthropomorphic measures. We'll have an assistance and caregiving section, which will also bring in some of the questions around who's providing care for the respondent and whether the respondent is providing care to anyone. This is an example of kind of a simple, the derivation of a simple harmonized variable between different studies. So on the left here in this graphic, you can see harmonized MHAS wave 1. On the right, you can see it's a sister study in Brazil, ELSI, at wave 1. And both of these survey questions are asking about smoking. In MHAS, the first question that is asked is, have you ever smoked cigarettes? The answers are yes and no. If you answer yes, the next question you get asked is, do you smoke cigarettes now? If you answered that you had never smoked cigarettes, you don't get asked this question, which is obvious. And that's called a survey skip pattern. And survey skip patterns, you have to keep them in mind when you are trying to make comparable variables or make kind of a research-ready variable, because you often need to account for why that question wasn't asked. And for an example of that, let's look at the right side of this. So let's look at the Brazilian study, ELSI. So the first question that they ask is, do you currently smoke? And the answers are yes, daily, yes, less than daily, or no. And then if you answered yes or yes, less than daily, you could ask, have you smoked in the past? And you can answer, or no. If you say that you don't currently smoke, then you could ask, have you smoked in the past? And then you can say, yes, I smoked in the past daily. Yes, I smoked less than daily in the past, or no, never smoked. So you can see that both of these studies are asking questions about smoking, but they're asked differently. Their answer choices are different. And then the value to those answers are coded differently. So a no in MHAS is coded as a 2. For these questions in ELSI, a no is coded as a 3. So we have a harmonized variable that we make across all of our studies. And that's called smoke ev, so whether the respondent has ever smoked. So if we wanted to make a variable called R1 smoke ev, which captures whether the respondent at wave 1 had ever smoked from either of these studies so that it's comparable between them, it's really simple for MHAS, right? So we're going to use kind of consistent value labels. So for harmonized variables, a no will always be a 0, a yes will always be a 1. And it's very simple for MHAS. But for ELSI, we're going to have to account for that survey skip pattern to make sure that we can use one variable to appropriately measure smoking prevalence, smoking prevalence over a lifetime. So if someone said that they currently smoked either daily or less than daily, we know that they have smoked in the past. Or if they said that they don't smoke daily, but they have smoked daily in the past, or they have smoked less than daily in the past, we also know that they've also smoked as made into a comparable variable like MHAS asked. So this is a really simple example of creating a harmonized variable between these. They get a lot more complicated, especially when you think about income and wealth variables, which have dozens of different components and include imputing missing values. But I wanted to give you a sense of some of the advantages of using harmonized variables. So these advantages are partly for using it between studies, but also using it between waves of an individual study. So it could be that at MHAS, this question may be changed at certain waves, and we would also try to account for that cross wave skip pattern to make a comparable variable across the different waves of MHAS. To accompany the harmonized MHAS dataset, we have a codebook. It's a harmonized MHAS codebook. So it introduces the harmonization project and study. It overviews the survey timing, survey design, sampling framework. We discuss weighting and imputation. We detail the specifics of the harmonization process, and it divides variables into sections based on research domain. And we saw those sections earlier. This is an example of what we might include for each variable. So you can see here are smoking variables for MHAS. We can see both of them for the respondent and the spouse. You can also see that we've added some special missing value labels. So we have special missing value labels for .d, .m, and .r for when the respondent either didn't know, refused, or the answer was still missing. We detail the variable creation and any assumptions we made in the creation. And then we highlight differences between waves and any differences between this variable and the HRS version of the harmonized variable. So in this case, MHAS asked this question very much like it was asked in the HRS. So there's no significant differences if you were to use that same variable in the RAND HRS. The last thing that we do is we list all the variables from the originating data set that were used in the creation of this variable. And that can be really helpful if, for instance, maybe you disagree with the way that we coded these, or you just want to make sure that maybe you're using an older data set where you pulled in the variables yourself. What were the variables that we used? So you're able to do that by looking through this list. You can download the harmonized MHAS data file, codebook, and Stata creation code from the MHAS website under constructed and harmonized data page. The MHAS website, we'll jump back to our gateway website, is mhasweb.org. You can access it here. You can also access it if you're on the gateway already on the downloads page by going to download harmonized dataset or download survey data, all under this MHAS column. They're all going to lead you to the same place. So if you click on here, you can see that on the MHAS website, they have a tab for data, they have raw data, and they also have a constructed or harmonized data. And here you can see below here, you can download the harmonized data sets. So that's the data file, and that's distributed in SAS, SPSS, or Stata format. We also provide the creation code. So you can have the exact code that we use to build this data set. And again, if you wanted to see exactly what coding we used, or maybe you disagree with our assumptions, but you wanted to start with our code, you could use that. And then you could also download the codebook here. The Stata creation code and the codebook are also available from the Gateway website. You can download them here, but to get the data itself, you need to register, which is quite simple, but you can register and download it from the MHAS website itself. The comparable data files to the harmonized MHAS include the RAND HRS and the harmonized HRS, which represent both the HRS. The RAND HRS is kind of like the core harmonized data file for the HRS data set. It is done in conjunction with the work at the RAND Corporation. The harmonized HRS is kind of a supplementary data file, which is produced by our team at USC. And that just includes some extra variables which the RAND Corporation doesn't incorporate into their version, and particularly variables which are focused on kind of cross-study harmonization. So the RAND team is a little more interested in just comparing between different waves of the HRS. So some of those variables for cross-study comparability are in the harmonized HRS. Also the harmonized ELSA for England, the harmonized share for Europe and Israel, the harmonized Corellis for Costa Rica, harmonized CLOSA for South Korea, harmonized JSTAR for Japan, harmonized Tilde for Ireland, the harmonized Charles for China. And we'll also shortly be releasing the harmonized LASSI, which will incorporate the wave one or the baseline data for LASSI, which is the sister study in India. All of these harmonized data sets you can download. They're distributed either through the gateway or by the originating study. You can use that downloads page on the gateway to find links to any of them. You can see in the case of share and CLOSA, those two studies don't distribute the harmonized data sets themselves, but you can create it using the Stata code provided on the gateway website. All right, so the next thing we'll do is we're going to have a small sample analysis. So I hope now you're a little familiar with the MHAS and how the questions are asked. So now we're going to do a sample analysis kind of to get an idea of what it's like to actually use the data sets. We're going to use Stata for this, and we're going to be working with the harmonized MHAS data set and the RAND HRS data set. And to kind of motivate our analysis, we're going to ask the question, are there country level differences in the longitudinal patterns of disability onset by gender or wealth? So we'll pick apart the different parts of this. So country level differences in this case is going to be comparing between Mexico and the United States as represented by the MHAS data and the HRS data. Longitudinal patterns means we're going to look over time. So these are longitudinal data sets. So we follow people and interview them at multiple time points. And so we're going to compare their changes over time. We're going to be looking at disability as modeled by whether they have difficulty with regular activities of daily living. And this is a disability onset, so whether someone started to need help with one of those regular activities of daily living. And then we're going to look at those over gender and wealth. So our steps are going to be first to download the harmonized MHAS and the RAND HRS data. You can identify comparable measures in the MHAS and HRS. We're going to create a pooled data set with observations from both harmonized data sets. You don't necessarily have to create a pooled data set. Sometimes you can do cross-study analysis by just doing kind of the same analysis separately in different data sets. But I think it's for certain techniques, you're going to want to pool them together. So I'm going to demonstrate here how you might pool them together if you wanted to. We're going to prepare our variables. We'll talk about applying weights, and then we'll analyze disability prevalence across country and analyze disability onset or incidence across countries. So we know how to download the harmonized MHAS data. We saw that already. The RAND HRS data is just as easily as available to download as the RAND HRS data. You do that from the HRS website, which is hrs.isr.umich.edu. And under RAND HRS data products, you download the RAND HRS longitudinal file. The next thing you're going to do is going to identify comparable measures in the MHAS and the HRS. And there's a couple ways to do this. If you wanted to use the Gateway to Global Aging Data page, you could use the documentation page, our concordance search, or looking through the Harmonized Codebook. So both the RAND HRS and the Harmonized HRS have the codebooks that you could look through. I'm going to also show you how to use the Gateway to search for some of these things. So back at the Gateway, if you clicked on Surveys at a Glance, you can see here we have this search bar at the top. And so one of the things that you can do for common variables, so we mentioned gender and wealth, right? So in our subtopics here, we're going to go to demographics. We can include gender, and then we can also go to financial and housing wealth, and we're going to look at total wealth here. So we can look for these variables, and we're going to say we're going to look for them from rand HRS or harmonized HRS. It'll tell us which one they're in. Again, they won't be in both. It'll be in one or the other. And harmonized MHAS. And we know that MHAS started in 2001. So we're going to look just over the years 2000 to 2016. And if we search for that, we can see for harmonized data, we have some results here for rand HRS. So we have a gender variable called RA gender, and you can see how it's coded. You can also see once you go a little further, we have a wealth variable called, we have a total wealth variable across all kinds of assets. You can see some information about that. And we have a version A and a version B. Version B includes the second home. And then we could go to the harmonized MHAS and also look at the wealth section. And we can see that we have a ATOTB. So that version B is comparable. We know that because the variable name here is the same. So the total assets, including second home here. So we have comparable gender and wealth variables in both data sets. So using this kind of concordant search on the gateway is kind of a helpful way to find these comparable variables. Of course, you could also look through the harmonized data sets, the harmonized codebooks themselves, or actually the data sets, which include variables which are appropriately labeled and named. So we're going to look for comparable measures of functional status. And in this case, we're going to be looking at our activities of daily living. So we have 5 of those we're going to use, which are comparable. We're going to look at education if we wanted. In fact, we're not going to look at education. For this analysis, we're going to look at wealth and gender also. So the first thing we'll do is we'll identify our variables for the harmonized MHAS. And I'm not going to walk through finding all of these directly, but I've listed here the variable names that we're going to use. So we're going to include some identifiers. All of the harmonized data sets always have the unique identifiers used by the studies. And that's important because, as I mentioned, the harmonized data set doesn't include all of the variables that are part of, from all of the questions in the study itself. So, perhaps you want to use some variables from the harmonized data set because they're comparable and they're cleaned up and the survey pattern is already accounted for. But you have maybe one particular variable which isn't part of the harmonized data set which you want to use. So these unique identifiers allow you to always merge in the original data if need be. We have a 5-item ADL summary that's created. We're going to look over 2001 and 2012. So that's wave 1 of MHAS and wave 3 of MHAS. So that variable is called ADLA. We'll get version R1 and R3 of that. Our gender variable, as we saw, our household wealth variable, as we saw, we'll get a variable for their age in at wave 1. And we'll get household analysis weights for 2001 also. And then from the rand HRS, we're going to get similar variables, but the names will sometimes be slightly different. So the identifier name is going to be different. Of course, unique identifier is not comparable across different studies. Our age variable has a slightly different name in the rand HRS because they provide variables at the end, the beginning, middle, and end of the interview in case the interview, sometimes the interviewer would come back, maybe they don't finish the interview, and maybe their birthday was in between, so they provide that. And then also the individual and household analysis weights. So the first thing we'll do is we're going to create a pooled data set. So the rest of our slides will kind of look like this, where you're going to see some Stata code. And I'll talk you through the Stata code, and then we'll look at the results on the screen for Stata. So the first thing you want to do is read in the harmonized MHAS observations and variables. So we'll do this using the use command. So we'll say use. We'll specify the variables that we're interested in using from the harmonized MHAS. And we'll say those from HMHAS. We're also going to make a variable called ISO country. And that's going to identify all those observations, which we just read in from the harmonized MHAS. We're going to give those a value of 484, representing, that's the Mexico 3-digit ISO country code. And then we're going to read in the rand-HRS variables and observations. And to do this, we're going to use the append command. So use replaces the data that's currently in the data set for Stata. What append does is append puts the data that's read in below the data set that's currently there. So it adds it to the data set. So we're going to say append using the rand-HRS data, and we're going to keep these variables. So again, we're only specifying the variables we want to read in. Because there are so many variables that are parts of both of these data sets, it's often helpful just for your computer memory or for the version of Stata you have to only read in the variables that you need to use. Of course, we could read in both of these full data sets, but it might slow things down, or it might be hard on our computer, or we might have a version of Stata which just can't hold maybe the 20,000 variables or something that it would be contained in these two data sets. We're also going to identify those observations which we brought in from the rand-HRS as coming from the US, as represented by the numbers 840, which is the ISO country code for the United States. And we're going to write out some value labels. Also, as I mentioned, I'm going to provide on the Gateway website after this webinar this Stata creation code so that you could have this code if you wanted to use it for yourself. We're going to adjust for the differing wave numbers in variable names. So if you notice, for our wave numbers, for our variable names, we refer to the wave number in the variable name. But for instance, both the HRS and MHAS had a survey that was conducted in 2012, but that was wave 3 of the MHAS and wave 11 of HRS, so they're not comparable. So what we're going to do instead is we're going to change our wave indicators into year indicators so that we know that they're comparable. So we'll do that for, it's 2000, 2001. We're going to call it 2000. And we're going to say, we're going to generate a blank variable. We're going to say replace that blank variable with the values from the variable R1 ADLA if that observation was labeled as coming from Mexico. And then we'll do the same, except taking the values from R5 ADLA if that observation was from the United States. And we'll do that for several of these variables that we're going to use, including, so these are our how many disability indicators, or how many difficulties of disability they had, their wealth variable, their age variable, also with the person level weight variable and the household level weight variable. And then we're also going to make a household ID that we're going to use, which would be comparable across the different studies. So this variable that we have currently of R2000 ADLA counts the number of activities of daily living the respondent has difficulty with. So these include things like dressing, eating, getting in and out of bed, and it can range from 0 to 5 because there's 5 of them. So what we're going to do is we're going to create a secondary indicator which kind of summarizes that by just saying whether they have one of those, at least one of those, or none of those. And we're going to do that using anegen cut command, and we're going to cut it at 1. So if it's 0, it'll have a value of 0. If it's 1 through 5, it's going to have a value of 1. And then we're also going to create an indicator of whether able individuals experienced an onset of ADL difficulty. And I use able to mean so someone who has no difficulty with individuals, no difficulty with activities of daily living. So in creating this variable, so this variable is only going to have a value assuming that in 2000, the person didn't have any difficulty. And then there's 2 outcomes that this group of people could have by 2012. So one here is this first line, which is that they would still not have any difficulty by 2012. And the second is that they would have developed a difficulty by 2012. There are some groups which we're going to be leaving out. And for instance, anyone who already had a difficulty in 2000, we're going to kind of ignore because we're really interested with this variable just about onset. So people who developed a difficulty. We're going to create a household tag. So that just is going to create basically using theegen tag command. It's going to go through and for each of the households, and a household could have in both MHAS and HRS, it can have a single person or it can have two people, right? And since we have individual level observations, for some households, they're going to have two observations per household, and for some, they're going to have one, whether they're single or they're coupled. But for creating a variable like the wealth tertiles, what we want to make sure to do is that we're only creating that. We're making sure that we're only considering each household, whether it's represented once or twice in the data set, only once in how we create our tertiles. So we do that using an xtile command in Stata. So we're going to create a variable called atotb underscore t, in this case for our tertiles. And that's going to be equal to the variable. It's going to be based on our total household wealth variable in 2000. So we're not going to make it for 2012, but just where people started in 2000. And we'll do it both if both people in Mexico, and then here below for people in the HRS. So that's the underscore M, the underscore H. We are going to take into account our weights here. So this xtile command will allow us to take into account our weights. And then when we say N3 here, we mean tertiles. And then because there are some households, and we do this only if it's tagged, right? But because there's some households or some observations which represent like maybe the second person in the household, the spouse of the person with the tag, we're going to also copy that value to them, because eventually we're going to be looking at individual outcomes, right? So ADL difficulty and the need for help. And then we're going to combine this variable here in this final step. So again, kind of like before, we're going to be taking the values from the Mexican variable if they were in Mexico, the values for the HRS variable if they were in the United States. We're going to create an indicator of age cohorts. So just using the age they were in 2000, we can make a couple groups. So we'll look at people who are, these are 5-year age categories. So who were 55 to 59, 60 to 64, 65 to 69, or 70 and above. So we'll have 4 age categories here that we'll make. In the end, we're only going to look at our kind of first 3 age categories, actually. And we do that using that egen cut command. And then we're also going to create a flag for our analysis sample. So we're going to say, we're going to consider someone is in the sample if they were between the ages of, if our age category had a value of 0, 1, or 2, which meant that they were, their ages were between 55 and 69. And they were not missing this R2000 any ADLX X variable. They don't have a missing value for that. So meaning that in 2000, we know how their value changed between 2000 and 2012. Of course, there are going to be people who, for multiple reasons, we don't have information about in 2012. So maybe we have information in 2000, but by 2012, they have left the sample, or maybe they have passed away, or maybe one of the studies wasn't able, they moved, and the study couldn't get in contact with them. So we're not going to be able to account for them. And whenever you're doing a longitudinal analysis, you always want to think about who are these people who you're not accounting for by looking over time, and is that biasing your result in any way? And we're not going to do that in the context of this analysis, but I just want to point out that's always important to do for longitudinal analysis. We're going to apply our weights. One of the nice things about Stata is that it has a lot of built-in weighting commands, particularly for complex survey data. So we can do that using this svy set command. We're going to specify our probability weight, and that's our combined weight that we created here for both studies. And we're going to stratify it by ISO country. So what that does is that tells Stata is that for each set of those weights, they're specific to the different stratifications, those different strata, and those strata are defined by ISO country. So we have weights for HRS and weights for MHAS. So to begin with, when we finally get to our estimation here, we're going to estimate disability prevalence In each country, for all people in our sample, all people in our sample separately, for Mexico and for the US. So in this first line here, we're going to say SVY, and then we're going to use, so SVY tells Stata to remember what we said at SVY set. So we don't have to repeat the weighting or the stratification information again. We're going to say SVY with this optional command here after SVY of only considering the subpopulation, who again is age category 0, 1, or 2. So between 55 and 69, or was it 50? Let's see. It was 55 and 69. And who is in Mexico with that first line. We're going to look at the proportion of them who had an ADL difficulty in 2000. And we'll do the same thing for the US. You can also do this in a single line instead of doing it separately. So we can also estimate disability prevalence for each country for all people in our sample in a single command. So instead of doing one command for Mexico, one command for USA, we could also include at the end of this an optional command called over. We're going to say over ISO country. And our result in Stata is going to look like this. So you can see that we have an estimate for both the US and Mexico. This is a command which estimates proportions. So this is a proportionate. So they're going to give us the proportion that they estimate who won't develop a disability, and then, or no, who don't have a disability, because we're looking at prevalence here, and then also who have a disability. So we're going to really just focus on these who have a value of 1 here. So you can see in Mexico, we would estimate that for our sample of people who are 50 to 69, we would estimate that 7% of those basically have a disability at 2000, and we would estimate that 11.5% of those have a disability in the US. And we can also just look at that graphically. So we can see that looking at prevalence, just looking at who has the disability in the year 2000 or 2001, the US seems higher than Mexico. And then what we're going to start to look at is, instead of just comparing these countries, we're going to look at some of the differences, as I mentioned, inside of those countries. So it's a difference in difference kind of analysis. The first thing that we're going to do is we're going to look, so before we looked at prevalence, that was just the rate of the people who had it currently. But if you remember, we also created that onset variable, or what we're going to look at it, we're going to estimate incidence here. So our command is going to look very much the same, except our proportion is going to be run not on whether they had an ADL, but whether they developed an ADL change over 2000 and 2006. And here we can specify that our subpopulation was defined by that variable we made before called sample. So if we have a value of 1 for that variable of sample, we're going to estimate their proportion. When we look at these results here, again, we're going to look at our yes result. So the people who did develop, incidence is often looking at the number of developments. We can see that actually it looks kind of different picture for incidence rather than prevalent. So of our people that we're looking at, so these are people who were 50 to 69 in 2000, we would estimate that 17.4% of those in Mexico would develop a disability by 2012. But in the US, 13.1% of those would develop a disability by the US. So they're pretty close. If you look at our confidence intervals, they're certainly within kind of, they're not that statistically different, but they're pretty close. You can look at that graphically here. And then let's begin to look by different kinds of people inside of each country. So our command, again, is going to look remarkably the same. But here on our over command, instead of just saying over country, we're going to add our age categorical variable. So what that is going to do is it's going to cross tab our 3 age categories we're considering with ISO country. So we're going to get an estimate for our 3 age groups for Mexico and an estimate for our 3 age groups for the United States. You can see that here. Looking at the second half of these results, so the yes results here, you can see we get an estimate for people who are 55 through 59 in Mexico, 60 through 64 in Mexico, and 65 through 69 in Mexico. And then the same thing for the US. Instead of all of these numbers, particularly this is easier to look at graphically. So we can see that we do see that more people are likely to develop disability who were already older in the year 2000, right? That's how we defined our age categories, which makes sense, right? You assume that people would start to need help with some of those activities of daily living older. Of course, they're also 10 years older in 2012. You'll also notice, as we saw before, that it looks like Mexico does kind of have higher levels than the US, but maybe not really that much higher. We could also look perhaps across gender, so maybe that would be a little more interesting than just age categories. So our command is going to look very much similar. So we're going to say over ISO country, but then we're going to say, instead of saying age categories over here, we're going to look over gender. So in this case, we're going to kind of cross-tab country and gender, and we'll look at men and women in Mexico and men and women in the United States. And we can actually use a post-estimation test to test whether we see a statistically significant difference between the estimates. You can do this using test after our command inside of Stata. So we can say test, and this is kind of how you would write this post-estimation test after a proportion estimation in Stata. So this is the test of the people who have a 1 for having developed a change with an ISO country code of 484 for Mexico with an RA gender value of 1. So that's how you read this. So the thing that we're comparing here is people who developed a difficulty who were men in Mexico versus the women who developed a difficulty inside of Mexico. And then we can do the same thing for the United States. So kind of your first results for your main command are going to look like this. If we look at this graphically, one of the things that we see that's really striking is there's almost no difference in the United States between men and women about developing a difficulty or a disability. But it does seem like there is possibly a statistically significant difference with men and women. We certainly would estimate that women have a higher proportion, a higher likelihood of developing an incident. So we would estimate that 20% of women would develop an incidence between 2000 and 2012, where only 15% of men would. And then we can look at our kind of post-estimation tests. So these are these two tests that we run afterwards. This is the one at the top here for Mexico, and then below for the United States. You can see, of course, for the United States, it's not statistically significant at all. And actually for Mexico, it doesn't look like it's statistically significant. So although there does seem to be, I wouldn't call it a small amount of difference, it doesn't pan out to be statistically significant using an adjusted wald test, which is the test that this post-estimation test that Stata performs for us. And lastly, we could do the same thing looking across wealth. So again, this is kind of what people refer to as a difference in difference analysis. So we're looking at the differences in Mexico and comparing them to the differences in the United States. So might we see a different relationship between people of low, middle, and high wealth in the United States versus low, middle, and high wealth in Mexico? So again, our commands are going to look remarkably similar. And our over command option here, instead of over ISO country RA gender, we're going to have over RSO country R2000 ATOT underscore T. So that's our wealth tertile. So we'll have low, middle, and high. And then we can also test the difference between people of low and high wealth in Mexico, and test the difference between people of low and high wealth in the United States. This is what our first kind of result will look like. So of course we have two countries and 3 wealth categories. So if you look at the bottom half here, we're going to get 6 wealth estimates. If you look at that graphically, it looks like this. One of the things that you can see here is that actually it looks like wealth in Mexico is perhaps not so tied to, or not so associated with a difference in disability incidence, but it looks like it is the United States. Particularly people of low wealth in the United States seem much more likely to develop a disability compared to middle and high wealth people, where that distinction really doesn't exist, apparently very much in Mexico. And we can test that difference. And what we see is that indeed for Mexico, the difference, although there is some difference, it's not statistically significant difference, similar to kind of how we saw gender, the difference in gender in Mexico. But we get a really statistically significant difference looking at the differences between low and high wealth people in the United States, suggesting that there's a lot of inequality that might be kind of tied to perhaps people's healthcare or their dietary habits, or their anything that could be related to developing a disability. So that's kind of our example analysis. I hope that was kind of informative about how you would use harmonized data sets and how you do, just some of the common day-to-day features inside of Stata of cross-study analysis and looking at a difference in difference analysis. You can learn more about MHAS sister studies and comparable harmonized data sets at the Gateway to Global Aging Data. We also have a help email desk called help@g2aging.org. We try to answer emails within 24 hours if it's not on the weekends. And we really want to be a resource for researchers. So if you have a question about getting access to the data or getting started, or wondering whether something is comparable between different studies, we'd really invite you to reach out to us. The Gateway is really a site that is set up to help facilitate researchers using these studies. So really, we're here at your service. It's a whole team of people who work on this. For the MHAS, we work very directly with the great people at the University of Texas Medical Branch who help run the MHAS study. So I'm happy to answer any questions for the next 10 minutes or however long. But I hope you enjoyed this webinar. We will have more webinars in the future. We try to have them every maybe 2 to 3 months. If you have any ideas for topics for a next webinar that you would like, I encourage you to let me know through a question or answer, or to just send us an email about a webinar topic that you would like. And the recording of this webinar and the Stata code and the slides will be available on the Gateway website. I'll show you where they'll be here. If you go to documentation and presentations, you can see recent presentations. So sometime tomorrow, we'll put up here the slides, data code, and video from today's webinar right here on the website. So you can download those. And you can also look at other webinars that you might find interesting to yourself that we've conducted in the past. So I'll just be taking any questions now if anyone has them. If not, thank you so much for joining. Feel free to use the chat window also. It looks like Preti has their hand raised. Preti, if you wanted to talk, I have unmuted you.
Hi, can you hear me?
Yes, I can hear you great.
Well, thank you so much for this excellent presentation. So informative. You really literally walked us through the steps and even provided a very awesome example. So this has been really helpful. I have a couple of questions. And my first question is, you mentioned the Mexican cognitive assessment. That's also part of MHAS, is that correct? And is there a harmonized MexCog data available, and when would the biological markers be part of that?
So MexCog is part of the MHAS dataset. It is kind of a separate study. It's not like directly incorporated into one of the core studies. If we go back to the MHAS website, let's see if we go to, I think it's under, let's close this out. the MexCog data is available to download, I believe, and we are developing a harmonized MexCog, which will be really comparable. The idea is that there's maybe 5 or 6 studies so far which have had a MexCog study, and it'll be quite comparable between those. Yes, so you can see here is information about getting access to the MexCog dataset and documentation. That's here. The MexCog data, my guess is the harmonized MexCog data would be available sometime. I don't want to promise by the end of this year, but I would say early next year, certainly. You can also see which other studies have an HCAP study. So we have one called Harmonized DAD for Lassie. That data is actually already currently available. It's in a beta version. You could download that. And then we're building one for the HRS, for ELSA, for the Chilean study, and for MexCog. So those will all be available. My assumption is either the end of this year or early next year to be comparable. And then secondly, I think you asked about the anthropomorphic measures and when they would be incorporated. My guess is also early next year. The anthropomorphic measures were collected at kind of the core interviews of MHAS, and those would become available in that next wave, or the next version, which will be version C of MHAS. Yeah, as soon as those are available, if you're signed up to receive, if you're registered in the gateway, you'll sign up. You can sign up to receive email announcements, and so we send an announcement when any harmonized data set is updated. We also have a Twitter and a Facebook, which you can get access to just from the top here. So if you prefer not email announcements, you could just follow us on one of those platforms, and we also announce any new data sets there also. So they're both the MexCog and bringing in the anthropomorphic measures into the harmonized MHAS are shortcoming early next year.
Wonderful. Thank you so much.
Sure. Thank you. I'm glad you enjoyed it. Are there any other questions? I'm happy to answer as many questions as anyone have, or if you think of a question later, feel free to email the help desk, and that goes to me and the whole team. Preti, did you have another question?
I did, but I was waiting for someone else to go.
No, feel free to go ahead.
This was regarding the weighing. You showed us the survey weighting, and you showed us using p-weight and the stratum-specific country weight. Let's say if you're only focusing on the U.S. health and retirement study, what types of weight besides the p-weight do you have to take into consideration?
So you will want to take into account that weight, and it is important. So there, as I mentioned, there's a household level weight and an individual level weight. We were looking here at kind of disability, which is something that happens at the individual level. So we used our individual level weight. If you were looking at something that's a household level measure, you'd want to use the household measure weight. But there's 2 other variables that are important to consider, and they're not available for all of the data sets, but HRS they are. And those are the inter-study, strata, and cluster variables. So almost all these studies use a complex sample survey design. So for instance, they pick certain clusters, and those clusters are stratified in a certain way. So if you one of the things that can happen in that is that your standard errors can kind of become artificially inflated because you're comparing people who live very closely together to each other, right? It's not an actual random sample of every 1,000th household in the USA, for instance, right? They kind of do that by picking out 1,000 different clusters of households and interviewing them. So if you want to, it's not going to change your point estimates, but it could affect your standard errors. So you want to account for that cluster and stratification variable inside of the study, if possible. And I didn't focus on it here because this is cross study. We have done webinars in the past where I've talked about that. I'm trying to remember if there's one that definitely does. My thought is that the Harmonized HRS end of life webinar, I think that we do that in there. Let's see if I pull it up. We're gonna look at it. Let's see. Merge it together. No, actually, we don't, because that's right. They don't provide weights for the exit data yet. We also did one with Elsa recently. That's a life history one. I don't remember off the top of my head where it is. I can certainly send you, put it in an email to you. I don't mind that. It's not that hard. It's just in the, one thing I can do is just pull up the RandHRS codebook and show you those variables. So the stratification variable is going to look much the same, but the cluster variable will look different. Actually, I think HRS has a section on this also. If we just go to, yeah, so they have this this nice paper that the HRS team has come out with about using the complex sample specification for SAS, Stata, and WESVAR that the HRS has done. And so if we go down to Stata right here, so it's going to do SVY set, and then this is your clustering variable. Here's your weight. And then your stratification variable is going to look like this. And then you can specify what to do with your with how you think the errors are correlated, basically. Yeah, so that's what that would look like there.
Thank you. This is very helpful. Thank you so much.
Yes. Any additional questions? Maybe in the next 2 minutes. I don't want to take up too much of anyone's time. Nikia, if I pronounce that right.
Hi, yes, Tristan, it's Nikia.
Yes.
I just want to clarify with the HRS data, to create the harmonized HRS currently, do we need to use only the RAND HRS, or you use both RAND HRS and harmonized HRS?
So
yeah. This is for cross-study comparison.
Yeah, so that just depends on what measures you're interested in using. So for instance, we just did a cross-study comparison and we didn't need to use the harmonized HRS. One of the things that, if you remember, that I had mentioned at the beginning of this accidentally, was that I said we might look at education. So education is not that easily comparable between different countries. And one of the things that we've done as part of the harmonized HRS is we've built an education variable, which is comparable using international educational codes between different countries. So if you wanted to use education, then you would also need to use you would need to use the harmonized HRS also. For simplicity, I just kind of dropped education from this webinar, so we didn't have to focus on using 3 data sets and only 2. And again, I think the easiest way to kind of figure out which one you need to use, whether it's in the RAND HRS or the harmonized HRS, is you could just use keyword. So for instance, if we look for disability, and then we go to harmonized data set, you could see which ones are in the RAND HRS versus the harmonized HRS. So it's really just dependent on what you're looking at. I think for lots of them, you'll be fine just using the RAND HRS. The RAND HRS that's like the main data set. There's just certain things where it's not ideal for interstudy or intercountry comparability.
Okay, great. Thank you. This is what I thought. And
yes, certainly. Anything else?
Thanks for your work. I've been using these data.
Oh, that's great to hear. Yeah, that's great. I hope it's been not too hard. I hope, yeah, cut down on some time for you.
Yeah, it has cut down on time. So thank you. Certainly.
Thank you. All right. Well, if there's not any more questions, then I might go ahead and wrap this up. Thank you again to everyone who joined. And yeah, I hope you look forward to more webinars. And if you have ideas for future webinars, again, please let us know. We're interested, you know, in knowing what interests you, you know, what seems like it doesn't make sense to you, or what are your kind of research goals so far. So thank you again so much for your time. I hope you have a great rest of the day.